Maryland Spotlight. It's all about Maryland living.
Welcome to Maryland Spotlight. I'm Kim Knight. Well, you work hard, you eat right, you work out, but you still can't lose those love handles or that dreaded muffin top. You know what I'm talking about. Well, joining me in the studio today, Dr. Brent Birely, artistry in plastic surgery. Thanks for being here today.
My pleasure, Kim. Thank you.
Great. So a new innovative procedure is here called Coolsculpting. Tell me about that.
Yeah, Coolsculpting is actually a revolutionary technique to get rid of subcutaneous fat, and it does it by freezing the fat without surgery, without anesthesia, with no pain, and it really is sort of changing the treatment of people with excess fat.
Now tell me how it works.
Basically, it's an apparatus, and they come in different sizes and shapes. Basically, this is one of the apparatuses, and it suctions the skin and fat up into this chamber, and then cooling panels on either side then basically freeze the fat, and then after an hour, the person's able to leave the office and resume their normal activities, and then over about 1 to 3 months, that frozen fat will gradually dissolve and go away on its own.
Absolutely amazing. Now tell me, who would be a candidate for Coolsculpting?
The best candidates are both men and women who have some localized excess fat, which is either in the upper abdomen, lower abdomen, love handles area, upper lower back and inner thighs, and they basically are just somewhere in the mild to moderate amount of localized excess fat in those areas.
Now how does this differ from liposuction?
Liposuction is an operation. It's done general anesthesia. Typically there is pain associated with it. People have to wear a garment post-operatively, and there's more complications associated with it.
Any risks involved in this procedure?
Actually, because of the fact that all you're doing is just cooling the tissues, there's very minimal risks. Occasionally people will have some discomfort for a few minutes or a few hours after the procedure, but rarely anything more than that.
And they're going to notice this, you said, between like 1 and 3 months?
Yeah, it takes about 1 to 3 months for the body naturally to get rid of the frozen fat cells once they've sort of dissolved and broken up.
Do you find that people have to do this procedure more than once?
The average person does get 2 treatments separated by about a month, because with each treatment you get about 25% reduction. So in order to get what most people want is a 50% reduction, it usually takes 2 treatments.
And that's really interesting. Now, if people want to get in touch with you to find out more, because I think this sounds really cool. I mean, non-invasive. You said sometimes people bring their laptops in or read a book and just chill out, and literally chilling out.
They lie there on the bed and they watch TV, they take a nap, and after 1 hour, if they're just getting one area done, or they can get multiple areas done at the same time, and then they get up and walk out when they're done. It's amazing.
That
it really
sounds
is
like
exciting.
really, really cool, actually. Now, do you have a website?
Yeah, it's AIPSMD, stands for Artistry and Plastic Surgery, AIPSMD.com.
Dr. Birely, thanks for being here today.
My pleasure, Kim. Thank you.
And thanks for joining us on Maryland Spotlight. I'm Kim Knight.